Okay, we're gonna start the meeting calling to order at 10:20. This is the Board of Health, Cowlitz County Board of Health meeting. Gonna start with some old business, just the review of the minutes. Did everybody get a chance to get a copy of the minutes and review them? Is there any changes or corrections? Then I'd entertain a motion to accept the minutes. Somebody would like to.
Would move to accept the minutes from the, looks like October 31st meeting.
Motion on the floor to accept the past meetings minutes from October 31st. Is there any further discussion? Let's take a vote. All in favor, say aye.
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 Aye. Any opposed? It's passed. Okay, going on to the next one, we have a motion that was already made, tabled from the last meeting for the medical freedom resolution. And I'd like to open that up for further discussion. Mary Jane?
I'm wondering if, and I'm not a lawyer, will this resolution have any legal impact on any of the citizens in Cowlitz County?
It's more of a statement. It's a statement, not a not a ordinance. It's a statement and basically just expressing what the people have said and what this board decides to say. And legally, I don't think there's any legal complications with it, ramifications with it.
So it literally has no impact on the health of our community?
I wouldn't characterize it like that.
It gives people the right to choose their own form of health. It's telling them they don't have to be told to get a jab. They don't have to be told, I don't even know why they're, what would be the ramifications to people? Oh, you don't have rights now?
Well, I guess, I've had a,
You're confusing me here.
sorry.
This is very simple. It's telling that you have the right to tell what happens to your body. It's pretty simple.
so I've had, unfortunately, the occasion to be at Peace Health recently, and Peace Health requires people to wear masks. So, is that going to change?
No,
It does-
private companies can do what they want to do. I've used if a fast food chain wants to make everybody and their employees and their customers wear masks, the Board of Health wouldn't say anything to it, but I'm sure they would not do well and with financially.
So back to my original statement that Rick raised a question with, there really is no legal impact at all. So in essence, it will not improve the health of Cowlitz County except for to make some people feel like they have more rights than they actually do.
What? Well,
If I may, Mary Jane, I was okay with, there is no legal impact. Many things have unintended consequences and, right, and in this case, certainly it would be my intention to vote for this with the unintended consequence that people will realize that their health is their responsibility. So don't drink too much, don't smoke, don't, all that's your responsibility. I'm not going to go and tell somebody they can't do those things.
But I guess my point is there's no legal implications at all, no legal. I mean, this doesn't protect anybody who wants to walk into Peace Health without a mask. Is that correct?
I think the most important point is number 2, and I'll just read it for you. Cowlitz County shall not force any individual person to put something onto or into an individual's body without informed consent of said individual and respect their right for refusal.
So when you say Cowlitz County, do you mean the county administration building or county offices?
Cowlitz County.
So, but back to my point, Peace Health requires people to have a mask to enter the building.
They
And
can still do that.
And
That runs counter to what you just read to me, that Cowlitz County will not force anybody to put something onto or into.
Well,
Mary Jane, can I just step in?
Absolutely.
The one thing I feel about the resolution is that it's making a point that there are a lot of people, at least I've talked to a lot of people, and in my opinion, a lot of the decisions that were made weren't accurate or correct. And so it gives us the right to question authority. That's what I feel like the resolution does.
And I think that you make a good point. What I would think is makes more sense for this board to focus on is to reach out to our state and federal delegations and say, what went right and what went wrong in our country in response to COVID, and try to figure out how, if there, God forbid, is not, but if there is another pandemic, can we do it better?
Well,
Actually, the first page says a lot of things that went wrong. So,
Well,
and nobody
except
else
for-
has come up with that,
Except for that, I think that the first page maybe has some inaccurate information. So
which,
I
which,
struggle with
which
that.
point, because now you've had 9 weeks and you have not said one word about the content of this resolution. So please speak up.
So I am not a medical professional, but I have spoken to medical professionals who pointed out a lot of inaccuracies, and at a minimum,
Which one?
excuse me, and at a minimum, it's not documented. The other issue is that when I look on the website, 67% of Cowles County residents have been vaccinated. So that suggests to me that many, many people do support vaccines and do support wearing masks. And this may or may not be reflective of the entire
They
community.
can still do that.
Thanks.
It's a medical
Nobody's telling
freedom
them
of
they can't
choice.
do
People
that.
get to choose that, is what it
We're
is.
saying
you
you
get
have
to
the
choose
right to
that
make that choice.
Unless you want to go into Peace Health, and then you don't have that right. So are we telling folks you have the right to make that choice?
They have the right to make that
reality-
choice.
they can walk
And if
away.
they don't want to walk into
They
Peace
can
Health,
walk
they
away.
don't have to.
So I'd like to speak up for a second. I did a lot of vaccines during the COVID pandemic. I didn't do any without informed consent or right to refusal. I take a lot of offense to the fact that that's implied that front care healthcare workers did that. As a active duty officer in the public health service, I'm required, mandated to get vaccines. If I choose not to, I can leave the service. That's okay. That's my right to leave. I get those vaccines with informed consent. I think that what is said in this document is not going to have an impact on health. It's not going to have an impact on what the state or federal government does. And it's been a real waste of time, it feels like, because as Mary Jane and others have pointed out, this isn't really going to have an impact. And I think it's misleading to the citizens to say that it's going to. I believe it's a political statement. A lot of these statements on this front page of this resolution are may be accurate, but may not be. We don't know if mandates have had an impact yet. It's not been long enough to figure that out. Public health is hard. Research about public health is hard. So if we sit here and say, this absolutely didn't work, I think that that's really premature. Maybe it did it, maybe it didn't. We need to do a reflection. I think that one of our citizens pointed out last time that after Katrina, there was a big overview investigation. What went right, what went wrong? That took a long time. A lot of things changed after that for the better, I believe. But if we jump to these conclusions now, I think we're doing a disservice for future pandemics. Also, as a representative of the Cowlitz tribe, a population, the American Indian Alaska Native population was affected at a really much worse rate than the general non-Hispanic white population. Rates of hospitalizations were 3.2 times higher for American Indian Alaska Natives, and deaths were about double that. So on this front page, there's a lot of language that kind of tries to minimize the severity of COVID. And I think that's really damaging to the community that I represent. And I just wanted to make a statement that I think it continues what we see with American Indian Alaska Native healthcare, which is that there's marginalization, minimization, and inequity. And I just can't support that because vaccines were really what decreased that inequity.
Well, I think there is some question about that, to be honest. And so it's hard to say what's right or wrong, but I think that we're just having an opportunity to say that we question and that we want to give people the right to question their health and their care for their health. That's all that I feel about that.
I think that people can question, but I think that a lot of these statements imply that everything was mismanaged and wrong. And I don't think as a board of health here with no real expertise in that, can we make that statement? We need to just support that that's investigated and discussed. And to imply that we were giving out vaccines without informed consent, I, as a registered nurse, a public health officer, that really saddens me that we would even say that.
Well, I think there was a question about the safety of it, and it isn't a typical vaccine that's been used for years and years and has been tried and true, and the known side effects were made aware over the years. This was a brand new experimental vaccine. And as far as informed consent, I doubt that people really did get all the information about potential side effects and deaths, and because it was a new thing. And so I do question the informed consent part.
When you see the commercials on TV, especially the one that really struck me was the worst was Elmo from Sesame Street was bragging about being a hero to get the vaccine, and to little kids. This was marketed directly to children. Get the vaccine and you'll be a hero. It said nothing about the adverse side effects. It didn't say anything about that you could die from it. And just as for statistics, this was pulled from the VAERS system last night. There's a lot of parameters, a lot of information on there, but just two things that stuck out. In the last 3 years, 318 people have died from vaccines, all vaccines. That's flu, any kind of vaccine, 318. 222 of them were just from the COVID. So that's 67% of the deaths in Washington. So there is a problem with the vax. We need to inform the public that there is some risk to it, and it hasn't been portrayed that way. We were told that it was safe, that if we just wait 2 weeks, it'll all be over. They said that masks are not necessary, then they said, yes, 2 or 3 masks on top of your face will help. Then they said, if you get a vaccine, you will no longer catch COVID or spread COVID. That's not the case. That's not the case. So that's what we were told. And I will quote from one of the letters from Peace Health, doctor from Peace Health, that said the CDC has already admitted that they failed us. And this is correct. That came out a couple days ago or a week ago. And they also said that our passion, I think he was talking about mine, but the boards of health's passion based in this resolution to the response of the pandemic is warranted. This is the doctor from Peace Health telling us that we are warranted in doing this, and that he even goes so far as to say that the Board of Health should find an independent COVID-19 committee to go back and look and see what went right and what went terribly wrong. Because I think we failed the kids.
So
We closed the schools and they were the least vulnerable targets of the virus. We closed the school and these kids are way behind, and that wasn't right. And the only statistic that's on this resolution is saying that the death rate is less than 1%, and that is a fact. It's quite far below 1%.
So I guess my comment to the Peace Health doc is he appreciates our passion. Did he say he appreciates that document or that he thinks it's well thought out or accurate?
The corrections that he suggested have been made, and he did applaud it.
That was Dr. Hickey, but he
Correct.
did not appreciate the document.
No,
So
he
going back
actually,
to,
you-
going back to.
you can read his letter.
I did
It's-
read his letter.
Okay, well, he says that he kind of liked
Did you
it.
read Dr. Ford's letter? Where he talked about an
Yes.
18% increase? I guess I wonder how you explain that, how that is explained.
18% increase in,
There's a 15% increase in deaths in Cowlitz County.
still less than 1%.
Excuse me, 15% increase in deaths in Cowlitz County from 2020 to 2021. What do you attribute those additional deaths to?
Could be the vaccine. I don't know. I'm not a doctor.
No, you're not a
Boosters.
doctor, and neither am I. And that's
Right.
why I think it makes sense to listen to the folks who've come here, to the medical professional that we have here at the table.
Let's,
And I just can't support a document that doesn't have accurate information or documented information.
I don't believe there's anything inaccurate in it.
Just to comment, there are plenty of doctors on both sides of the divide.
That's
Yeah.
correct.
So,
So when I do look at the at the reports on the death rates in Cowlitz County, there was, I think it was 236 increase from 2000, what they predicted for 2021 and what actually happened in 2021. And so I'm not saying it's COVID, but if it's not COVID, what is it? And if it's not COVID, and we don't understand what it is, then we're not doing our job as a Board of Health because we're not protecting the public.
Well, the other side of that, though, is if it isn't COVID and we say it is, we miss an opportunity to find out what the underlying cause is.
I would love to figure out what it is, but we've spent 3 months talking about this document that has no legal impact instead of digging into the research and finding out what happened to those 236 people.
I don't think any of us had a mandate to avoid anything that our passion or heart wished. In fact, if you wanted to do that, did the chairman stop you?
I have sent numerous requests to the chairman asking for reports on other things other than this. STDs, it took us several months, but we finally got a great report from the Health Board for STDs. I've asked about opioids and opioids use and overuse, and that's been put off and we focused on this instead.
Every one of your responses has been documented and it is on the list. So nothing's been ignored, Mary Jane. I asked you specifically what specific comments or lines or sentences in
Right.
here are incorrect or that you had a problem with. And so far, you haven't said anything.
So I tried to, but I was interrupted. So if we go to whereas number 4. Oh, no,
Okay,
no,
lock-
1, 2, 3,
yeah.
4, yeah. So I think we should put a period after lockdowns, quarantines, and mandates have proven harmful to children's mental health and education, period. The rest of the stuff that you say is undocumented, and according to websites, it is inaccurate.
But isn't that enough? If you put a period right there, isn't that enough that this resolution should pass and be supported by you? If you agree that lockdowns, quarantines, mandates have proven harmful to children's mental health and education, isn't that enough?
Okay, so put a period behind there and let's scratch the rest of it.
Well, the rest of it has actually been documented. 1%. It's less than 1%.
236 additional people in Cowlitz County than was predicted by the data died in between 2020 and 2021.
Where did that data come from?
I have it
Let's,
here.
let's go to, if anybody else have something on the board to comment on that further discussion, then we can open it up for
So,
public.
Just a comment on informed consent. That's always a strange thing because if you are the person who's employed as a state patrolman, say, and you didn't take the jab, you lost your job. That's the kind of thing where I wouldn't say that because you took the job, it was informed consent. You took the job because you got to feed your family. So I just want us to be clean on that
It's
completely.
called coercion.
I think we need to recognize that public health is always about limiting personal freedom. And I know no one here wants to hear that because we all want to talk about personal freedom, but the whole idea and concept behind protecting the health of our community is that sometimes our personal freedoms get limited to protect those around us. And that happens by washing hands mandating hand washing by restaurant employees. It happens by mandating seatbelts being worn. And I think that by calling out COVID specifically, we're really going to make it difficult in the future to deal with emerging public health threats because we're looking at something we don't fully understand. We have a biased document that focuses on all the negatives, even though we sit here admitting that there hasn't been a full interrogation of what worked, what didn't. We don't really know. None of us. I mean, I have credentials in public health and nursing and everything, and I don't even know really what worked. I think we need to interrogate that rather than using what I know it's like a passionate topic and people feel really passionately about what went wrong and what didn't, but just because we feel passionately doesn't mean that we really know what didn't and what worked and what didn't. And if things changed throughout the pandemic in terms of guidelines and regulations, that's because that's how science works. We look at what's working, what's not, and then we change it. And that's just the natural progress of things. And
Yeah,
so-
that's ideal. However, in practice, if you tell someone they're going to put their hand on the stove and they'll get burned, They will test it, but nevertheless, eventually they won't put their hand on the stove because it's their self-interest. What we have here is a gap, a huge gap between trust of the people and trust in the government. And that would be a problem we ought to tackle. And we can't tackle that when we remain hidden, like I had asked often to put both contending articles on our webpage. It did not happen. At some point, you have to look at that as a censure. People are not stupid. If they felt in danger, you wouldn't have to have a mandate. So we just have a trust gap that we have to bridge.
It seems like by collecting more information and investigating what worked and what didn't, that should help bridge the gap versus just making blanket statements that we as a board really don't know what worked and what didn't.
The only statements I see we're making is people get the choice to choose.
Yep.
It seems pretty simple.
And Mary Jane
You
just
get
said
hung
that,
up on all the whereases, but the resolution is basically say people have a right to choose what they want to put into their body.
Yeah.
So the document or my statements having to do with the increased death rate between 2020 and 21 came from the Cowlitz County leading cause of death document, 2015 to 2021. So that's where that data came from.
so
Also,
what,
Dr. Ford's letter references that as well.
Yeah, when it comes to statistics, the sample size is important, the control group is important. And I would be far more swayed if I saw numbers that were normalized in some way. But we keep hearing about Sweden, we keep hearing about Florida, and
200 excess deaths in our county don't come from nowhere.
good grief.
May I
Wow.
address something from a
Wow.
previous meeting,
yeah,
We
Mr.
can-
Chair?
yeah, we
Mr.
don't
Chair.
want that, please.
No.
You're
Mr.
yelling.
Did we let?
Yeah,
did we let-
Yeah.
the question isn't that there were deaths in Cowlitz County. The question is characterization of it. And my sense on everything, and I ask for, when I'm on the dais for everything else, is lay it all out unbiased on the table so that people can choose. And at some point, if you end up feeling you have to do a mandate, you've probably missed something, because I don't think people want to put a pistol to their own head or to their neighbor's head and pull the trigger. And that's what's behind compulsion. You don't need to compel people to protect themselves.
The only problem with that analysis, Mr. Mortensen, is that we've already admitted this document doesn't have any force of law, doesn't do anything other than express the views of some members of this board.
No, I think it's the majority of the population of Cowlitz County.
Well, that's not being determined by this board.
We'll
that's-
see.
that's an
It's
opinion
by
that
all of
you
our
have.
constituents.
Who elected you?
All of our constituents is what I said.
So when you go to the website, 67.433 of Cowlitz County residents have been vaccinated. So that would suggest to me that the majority of our population supports and is willing to have a vaccine to protect themselves. So I don't know that this reflects the majority of the population. So I
Well, they
think
were
it's
forced.
Or they may want to keep a job. And I
Excuse
think
me?
that had a lot
Or they
to
want,
do
they
with
were
it.
forced to keep their job.
Well, they get a choice. They get a choice because they don't give vaccines unless they give consent according to the.
Let me
public
give
health
you an
service.
example.
And whether this passes or not has absolutely no bearing on those choices.
Right.
They don't.
So.
We
so
already
then-
agreed that.
Well, let's-
I would like to suggest, Mr. Chairman, we invite the audience to share their views.
I agree. And I'm surprised that you're against this, since a lot of it is based on the past resolution that you supported. Commissioner Weber. Please.
Oh, he was talking to you.
Some people had to leave to go to work. I stayed for the duration of the last meeting. That's how I fly. You had a gentleman here named Bob Runnels. He was from informedchoicewashington.org. He was the director. He came here with data and he submitted it to the staff for the record. Does the staff have a copy of that? Did the board get copies of that? Did the commissioners get copies of the of those hard copy documents? I'm not accusing Mr. Chair. But as for the jab, he did say that 212 people had perished because of the vaccine, the experimental mRNA. And it was an experiment. And a lot of people did not have a choice. They were mandated. And a resolution is, let me back up here. This is a suggestion. It's a policy. It's how Cowlitz County, it's not law, that's an ordinance. A resolution is a statement of where we stand. You can change things later. I like the way that you have it frankly written. I have constitutional rights and I have God-given rights for me just being on this planet. I shouldn't have somebody saying that I have to be injected with anything. I have to wear something. I have to do a particular thing. I have to apply something topically or inject it into myself. Period. Absolute. This actually is in our first founding fathers documents when it came time for the Declaration of Independence, as we have God-given rights. And this is a statement saying that. I see nothing wrong with saying that. Now, as far as the data goes, we can banter back and forth all the time, but even Fauci admits that he's made mistakes and and backtracks and says, no, I didn't. So let's just move on, make the statement that everybody has a right. If you're sick, stay home. You do that. You have people separate for diseases. Way back in the Spanish flu, people wore masks. They didn't do any good. If you can smell a fart through a mask, how's it going to work with a germ? I mean, common sense, but allow us to be human beings and free. I'm up here on a soapbox. I'm sorry, but I shouldn't have to do this, should I? And it was a leaky vaccine. They admitted it was leaky. You could have booster on booster and booster and still get it. And it's amazing how it's the only freaking disease that they couldn't actually find the virus for, but yet they had a patent on a cure. We have trust issues. I don't trust any of you right now. I told the board, I told the commissioners that I'm sorry, Arn and Rick, that I gave you heck and you know it, because I don't trust any of this health department after all this nonsense. Now, this is just a statement. It's not any teeth in it whatsoever. There's no fine, nothing else. It's a statement that makes us trust you. Because I sure as heck, and I know there's a lot more people behind me that do not trust the healthcare right now.
So you did mention our founding fathers, and I appreciate that. That gets into an area of my expertise. I did discover that back in 1776, when George Washington was putting together the Continental Army, one of the very first orders he gave was to mandate smallpox vaccinations. And, so we've had mandates all along. And the circumstances change. I don't think the science was nearly as sophisticated back then for smallpox as it is.
Well, you want to go
recently.
back
However,
biblically, we're not supposed to eat pork either, and now we know there's a reason you have it thoroughly cooked.
However, as you mentioned, this document doesn't change anything. Doesn't change anybody's rights. We've always maintained people have a right to make those choices themselves. And I think we have a county policy where the county will not mandate amongst our employees. I mean, we passed that. Yeah. And
Well,
this doesn't change anything.
Like I said last time, but Commissioner Weber, I thanked you for that right off the get-go at the beginning of reading off this resolution. I thank you for caring about our employees in the county. So why don't you extend it for the rest of us? Because you be the hero. And you know, there's no teeth in it. It's not a law, it's a statement. And you are saying by adopting this, that we are citizens. We're not serfs. We have rights. If I'm so scared of a virus, I can stay home. Hunker down. Hopefully have my groceries delivered to the house. Same thing if I was sick. There's been other diseases, tuberculosis for one, you know, isn't there a germination fee, time period and everything, and you quarantine. Well, my household, we got sick, we stayed home, we quarantined. My kids are emergency responders. They did likewise. And if it wasn't for them, a lot of people wouldn't have been transported during accidents. They subjected themselves to being out there on the front lines. You're kind of slapping them in the face by saying that they're non-human too. They don't have a right of choice. You know, if they like to contact this and have COVID over and over and over again, they're the heroes because it was a leaky vaccine to begin with. But we all have a choice. And saying that we all have a choice, that gives me a little bit more trust in you, other than feeling like I'm just going to be strangleholding to taking something that I don't agree with.
Thank you.
Mr. Chairman, I think there is a big issue for the Board of Health. It may not be here today, but sometime in the future, there'll be a disease and we will have to decide, is it a pandemic or not? Do we invoke mandates? And for that, we don't have any threshold. We just heard the smallpox reference, and that smallpox is very different than what we faced during the COVID, and maybe very different than what we face in the future. This COVID disease affected me because I'm elderly. Be kind, you're only slightly obese. And yet we made these blanket rules that impacted the population of youngsters where it wouldn't have really amounted to a hill of beans. And so we really probably need to work at some point in the future in a definition paper of some kind of this to what would trigger a pandemic response from a legal standpoint, I guess is the right word. For me personally, I've had COVID 3 times. The first time was rather nasty, but I would be beside myself if I deprived young people of the opportunity I had growing up. And that has happened. You've got a hand up that's
we have
been
a-
up there a while.
Yeah, let's take the hand up first, please. Go ahead, if you can hear us. Shannon online. Can you hear us?
He's on mute.
Shannon, if you're on mute, you have to unmute your microphone. Or we'll come back to you. Yeah. Please.
Chairman Lane, I should apologize for calling you a clown at the last meeting. Clowns do not deserve such malignment. It is an intolerable offense to civil society that you helm this board as Commissioner Mortenson's flunky. Indeed, it is a farce, a man so patently uninformed on medical science and so incognizant of public health policy is the chairperson of the Cowlitz County Board of Health. Specific to this spectacularly inane proclamation of ignominy, if Cowlitz County residents were to be collectively graded over the way we behaved during the pandemic, we would receive an F minus. The proof is in our death rate that was only exceeded by two extreme outliers representing tiny Columbia and Ferry counties. Essentially, we were the worst in the state. That you are not swayed by the fact 432 people perished so far in this pandemic only reinforces your ineptness on this board. It wasn't that masks and respirators didn't work to blunt transmission. It's that not enough of us properly use them. Thanks to shameless politicization of a novel respiratory virus we were learning about in real time, leaders like Commissioner Mortensen, current Representative Walsh, and former President and future prison inmate Donald Trump belittled, mocked, trivialized, and undermined every single public health measure we had at our disposal. And it was all just to flame a culture war, stick it to Jay Inslee, and own those libs. How dare you pretend to give a damn about those precious senior citizens when you did nothing to protect them? You still don't. It didn't matter that bodies were literally piling up like cordwood nationwide. The majority of this board didn't show any concern for our woefully fragile healthcare system or the human beings who facilitate it. They were taken for granted. They still are. This resolution trivializes the ginormous sacrifice healthcare workers bore for us. They kept us from the brink of social collapse despite your efforts to push us over the edge. You clearly have never heard the stories from the doctors and nurses staffing our emergency rooms, intensive care units, and COVID floors. It was constant death, a career's worth of emotional trauma and devastation crammed into mere weeks, sometimes just days. Medical interventions that normally would be utilized a couple times a year were being deployed several times a week. Patient after patient, loved one after loved one. It was relentless. It was a war against a virus you were carelessly spreading with your cavalier disregard for masking, social distancing, and refusal to vaccinate. Go talk to these workers. Listen to their stories. Look them in the eye and say masks and vaccines don't work and that there were not any excess deaths. Yet you believe you were a victim after all of this because you couldn't eat a cinnamon roll at Stuffy's, or because you choose to believe utter nonsense you read on the internet? This proclamation only memorializes how you failed to learn anything from the COVID-19 pandemic. It is an act of lunacy brought forth by literal sociopaths. This board has no legitimacy as long as Kelly Lane is its leader and Arn Mortensen is its brain trust. If either of you had a shred of decency, you would spare us your depraved resolution and resign in disgrace.
Don't worry, the resolution will allow you to continue wearing your mask.
I just have a quick question for the Board of Health. I'm just wondering, how often does the Board of Health get notified that restaurant workers are not washing their hands? Do you ever get a notification?
Maybe it might come to the health department.
I'm just wondering, because we all go to the restaurant and use the restroom, and every restroom has that sign up that they are required to, but how is that enforced? I'm just wondering, is that something that is even enforced? Anyway, I don't know how they'd enforce it unless they had cameras in there and they were watching or whatever. That, I just had that question. I've heard this issue come up.
It's
And
a good question.
thank you.
Thank you for this civil discussion you're having. I'm going to intend to continue that civil discussion and actually bring up actual science.
Thank you.
I am a retired healthcare provider for many decades. I take health very seriously. I was in your profession many, many years. I worked in EDs, pediatrics, and all kinds of facilities. And I'm telling you that if I thought masks worked, if I thought that vaccine was the miracle they were claiming it to be all over social media, all over the media, I would have said, oh my God, I'm going to take that. I took the flu for years. The flu vaccine for years was devoted to being vaccinated as a provider to make sure I didn't infect my patients. And I looked at the initial studies of the mRNA and I said, I am not touching this vaccine. I retired early to avoid having to be in that mandate situation. I used to work in Oregon at Emmanuel Hospital, which is a top tier trauma unit. And I worked in that top tier trauma unit. I'm not a coward, a sociopath, a fool, and I'm not undereducated. I can guarantee you that. But I have done so much research on this. The research gets more and more compelling at how bad this situation was. We now know that this disease, had very serious risk factors for the elderly, the obese, the diabetic. We could have kept those people sequestered. What we did was we punished everybody that was healthy to protect people we could have sequestered. And what did they do in New York? They put COVID patients in with these fragile people and killed them by the thousands. That's how some of that death toll got raised, because these people were not protected by the government. I do not trust the medical care facility anymore. I will not go to a hospital unless I'm in a trauma. I will not go for regular care. I find alternative methods trying to keep my health up because I'm an educated person. I take vitamin D. I do other kinds of things to maintain my health, keeping my weight down, exercising, and keeping my risk factor. I got COVID. I used ivermectin. It worked. Now the FDA is admitting ivermectin worked when they were telling you for 2 years it was horse medicine when they knew it wasn't, when they knew it was a top tier WHO recommended drug. And we now know that the vaccine was incredibly leaky, that it killed thousands of people worldwide. This is documented. There are autopsy reports where the cause of death is the COVID vaccination. There was a high risk thing. When you're actually demanding that people do something that they know is high risk, and we are also, all the studies coming back with the mask, I'm sorry, but there are lots of research. The New York Times just admitted that the lockdowns didn't work. This is from the New York Times. Washington Post did it recently as well. We're talking about an article from the 15th this month. And they're telling, we have Brown University about the students and how their delay was gone. We have studies from Johns Hopkins who talked about how there is no measurable effect from the lockdowns, and that Sweden, Florida, and other places that did not have lockdowns did much better and had fewer deaths. And whatever those deaths were, we don't know, but I guarantee you, based on this, the statistics around the country, we now know that the people getting COVID and having the worst cases are people who have been previously vaccinated. We now know that people who have been vaccinated twice have the highest risk of stroke compared to the general population. And we now know that this was not what it was, because we never in the past have we mandated masks, have we mandated vaccines when we forced everyone to do something when they weren't at risk. We've never done it. I lived through the Hong Kong flu. I'm old enough. In 1968, we had Woodstock that year. We did not put people into prison at home. We did not make people lose their jobs. We did not make people suffer at all. We helped the people that were sick, and we told people to stay home when you're sick. And that's one of the, wash your hands and stay home is the best way to stop a pandemic. Locking them in their homes where they can't get sunshine, where they can't get exercise, keeping them from their church, where they can't get emotional support and spiritual connection. These are not the way to handle these things. I'm sorry about the people that you've lost. I'm sorry about what's going on, but I'm sorry there's plenty of data to support what I'm saying. I've got my phone loaded down with studies. I could send them all to you and bore you to death. You'd have to spend 12 hours reading what I have accumulated. I'm trying to be concise as possible. And I appreciate what you're doing, Kelly. You are not a sociopath. I know you personally. I have high regard for you, and I have high regard for Mr. Martinson, who is an ethical and very intelligent person. This is not, that slander was not acceptable. And I just wish people would calm down and just realize it's just a statement saying you have the right to be an individual and to be free. And it's just the censorship that went on from Facebook, on the federal government, and the amount of profiteering that went on should be something we should look at as well and go, wow. When they finally admit how many mistakes they made, when Fauci admits the mask didn't work, he admitted it. When you have CDC admitting that the vaccine is leaky, and then we're still here debating like everything was fine. I'm sorry. Please pass a resolution and make the statement. That's all I have to say. I'm so furious about the whole thing.
Thank you.
I can't even stop.
Thank you. Do we have the online
Mr. Chairman,
person?
you have. Yeah, you have the hand up. Yeah.
Is he still there? Shannon, if you can hear us, please go ahead.
Good morning.
Oh, now
Um,
we can hear you.
You can hear me now?
Yeah.
It was a little technical difficulties. Sorry. I have a few things to say. First of all, I just want to thank you for bringing this forward. You know, I had an appointment in October at Peace Health in the hospital. I had an appointment this month in the hospital. The first one, I walked in and the lady said, you know, you don't have to wear a mask out here, which is funny because when the whole pandemic was happening, you had to mask up once you walked in the door. And I was like, I don't wear a mask. And she goes, well, you don't have to put it on until you get back in the room. I was like, yeah, I don't wear one. And I went and sat down. And I was never told to put one on. I don't have to. We don't have to. You can if you want to, but you don't have to. It's our right. And then the next appointment, I was asked, do you want your doctor to wear a mask? I was like, they don't have to wear a mask. I'm not going to wear one. That's at Peace Health. The thing is, now I'm going to reflect here. So my sister is a registered nurse. And so is my niece. And they've been working on, well, it's no longer a thing where they live now, but they were working on the COVID floor where they live. And you know what? It wasn't death every day. It wasn't. It wasn't body bags like the news was trying to tell you. Because I called her. I was like, oh my gosh, are we really in that state? Like everybody's dying? Like, are we really like body bags galore? Because I'm not seeing it here, but I am seeing structures outside the hospital where I live. And she goes, no, it's not that bad. It's like a really bad flu. And it can get really bad if you don't, if you're not taking care of yourself. This is coming from a registered nurse who has been a registered nurse for a long time. She had to get a jab. So did my niece, so they could work. Not because they wanted to, but because they had to, so they could keep food on the table. My sister started to have complications with her health. My sister has a lot of health problems right now because of the jab. And the reason why I can say that is because her doctor told her it was because of the jab. So I don't want to hear somebody tell me that we don't have enough data to say such and such. And I lost my father in May because of this. So when you come at me or anyone else with your data that is make-believe from Fauci, I'm going to look at you and I'm going to tell you you're crazy. So I want this resolution not because I think it has teeth and I think that it's going to give me what I need to say that I have rights, but because it backs me up. It backs me up because it's going to say, yeah, she does have rights. And I don't care what Tom says. I don't care what anybody else says. I know my God-given rights. I know my rights. And I will never close down anything because of some mandate. I will never wear a mask because of some mandate. Why was it that certain small shops had to close down, but the box shops had to stay open or got to stay open? You could go shopping at Walmart and Safeway, but you couldn't go shopping at the little store that was in the Highlands. Why was that? Why was that allowed? So I want this resolution to pass. And as for the Inuits, yeah, my mom's Inuit. My mom and I both got COVID, but we're still alive. So I don't want to hear anybody's data, anybody's stats or anything like that, because it's crap. Because it's not proof. It's not science. You're taking science from Fauci and Fauci's people, and you're just blowing it up. Quit trying to scare us. We don't need to live in fear. We should be able to go shopping. We should be able to go to the doctor's office. We should be able to go sit at a restaurant. And if we want to eat a cinnamon roll, eat a cinnamon roll. And if it makes you feel safe to wear a mask, then wear a mask. But I remember growing up that we were told, if you're sick, you stay home. Always wash your hands. You wash your hands before you eat. You wash your hands before you go to the bathroom. You wash your hands after you go to the bathroom. You wash your hands after you play outside. Hygiene. So maybe we do some PSAs on hygiene. It's not that hard.
Thank you for that,
Yeah, I
Shannon.
see that I'm being told I'm ridiculous, but it's not. But anyways, Kelly, I want to thank you.
Thank you for your comments.
And I hope that Dennis will stick with it, because it's not much different than what he wrote.
Thank you again.
Done. I just want to add one more perspective to everything. So my son, my youngest, checks just about every box for being at high risk for having complications from COVID, or any other virus for that. A simple case of the flu could land him at Dornbecker for the week easily. And of course, we all want our kids to have the opportunity to be safe, right? But given that, the responsibility for keeping him safe doesn't lie with a government agency or with any of you. That lies with me. That's my job. If I think he needs to wear a mask to be safe, I'll choose to have him wear a mask. If I think he needs to wear a mask and you need to wear a mask for him to be safe, I'll have him wear 2 masks. That's my job and my responsibility to keep him safe. Because you see, I'm the one who sat with him at the emergency room, and I'm the one who sat with him at Dornbecker. You haven't, and you don't know what would work for him to keep him safe, but I do. So the idea that someone would tell me what is safe for him to keep him safe, to me is quite preposterous, because again, that's my job to keep him safe. And I know what will keep him safe, and I know what will work for him. And I would never impose on somebody else's bodily autonomy to keep him safe. Again, that's my job. I would never be as presumptuous to think that I should impose on somebody else's rights to keep my son or any other member of my family safe. So given that, I fully agree with your resolution. A couple quick questions. Mary Jane, I think that's your name. Mary Jane, you'd mentioned that there were over 200 more deaths. And I don't remember what year you said, 21 versus 20 that was predicted or something like that.
Correct.
So just to clarify, were those COVID deaths or just deaths
No,
in general?
Those are in general in
Okay.
Cowlitz County. And
Okay.
so that's my question is,
Yeah.
what caused those deaths? And nobody here seems to have an answer or an interest in understanding what that
Well,
caused.
I think that's really worthy to look into, but I'm not sure the connection between that and this resolution. If you can't show that they were due to COVID, I don't quite understand the connection. I would encourage you to research that.
The data does suggest it's COVID, but I did not want to go out on that limb because I'm with you. I want to understand what all the causes of death were in this county, but it's peculiar that COVID came, a pandemic came, and our death rate jumped 15% between 20 and 21.
Yeah, there's also a huge increase in suicides because of the lockdowns and things. It identifies suicides. I'm sorry to interrupt. Okay, no, no problem. But there's also a huge drug epidemic, for lack of a
It
better word.
identifies those.
Okay. So, yeah, so those
can
are
get
great
that
things to look
online.
at. But I don't know if that quite relates to this resolution, if they're not all due to COVID. I guess I wasn't quite getting the connection. And then the idea that this doesn't have legal teeth, therefore you shouldn't be voting on it. You know, just a few months ago, there was a resolution, I don't know all the names, everything, resolution that passed here at the county that was in support of like National Real Estate Week or something like that, or National Housing. That doesn't have legal teeth. And those of you who've sat on city council before, I'm sure that you passed many of those types of resolutions. I'm not quite sure if that's what they're called, but National Read a Book Week, whatever they might have been, that don't have legal teeth, but yet you felt it was worthwhile to pass those just for public education maybe, or public knowledge. So I'm not sure if having legal teeth is a criteria for whether or not something should be looked at and voted on. So just one more thing. So thank you.
Thank you.
Mr. Chairman, if I could say one thing about that. First, it was a nice presentation. What a citizen should expect out of us is a balanced reporting of things, just truth. And we seem to fall very short of that because everything is politicized. And while we're being accused of being political, I'm really asking for us to put the data out there so that people can judge their risk versus their stakes themselves. And we aren't doing a good job of balanced reporting.
Kelly, I 100% support this resolution. I think it should have passed with your first draft. I think this is an excellent resolution to pronounce the fact that we have our freedom and our autonomy over our own bodies. And speaking of Peace Health and their mask mandate, I've had several appointments at Peace Health recently and just my cardiologist last week. And I haven't worn a mask yet. I know at the Lakefront Clinic, they told me that I would have to wear a mask when I went back, but I didn't, and nobody challenged me. Nobody gave me a problem. I won't wear a mask. There has been absolutely no documented, clinically reviewed studies and peer-reviewed studies that indicate that a mask has any effect on this COVID thing. And but to the contrary, there have been many studies that indicate that it has had deleterious effects on people's health by putting the mask on. So thank you very much, Kelly. And again, I support you 100% with this, and I think it should be passed immediately.
Thank you. We have another hand up online. Tindy, go ahead. Can you hear us online?
Needs to unmute.
You gotta take your mute off if the microphone. We'll come back to you if you come back. Wait. Oh, please.
Thank you. I appreciate all the work that's going into coming up with a resolution that would be helpful to people to understand that we, first of all, I joined the military in my young years, willing to give up my life to protect our freedoms. And I think the first thing that alarmed me about the vaccine was that it didn't go through the review process that was required through the CDC. They just abandoned that idea. And then I recognized that the pharmaceutical industry making a lot of money. They got a real sweetheart deal on this vaccine thing. And I come to realize that there's people that have the idea that they're saving lives. And at the same time, we have a lot that's in that same group that are promoting abortion clear to the point that the baby has already arrived. And there's a plan, it seems, that they would like to reduce the population of the world because they feel like it's overpopulated. And so we begin to lose trust. We lose trust in the medical community because they become politicized. And we've got a real problem staring us in the face on the political end of things. And we're here talking about a medical thing that we can't reach a conclusion on. We need to see what's happening to us now. What's going to happen to us? Is our lives just going to be extended for a while until the time that we're ordered by the point of a gun to do the things that political people want? I think we need to recognize that we may be a player in something, not even realize it. And that's mainly what I want to get across.
Thank you for your comments. Is the online person still there? Would like to comment? We have one in person here. Good.
Thanks for the opportunity to comment on this.
So just one thing, is there something new? Since you've spoken a few times, you're welcome to speak, but I'll hope you can maybe bring something new.
Am I able to make my comments now?
Yeah.
Great, thank you. So in the revised Code of Washington, these are the laws of our state as passed by the legislature of our state, which is duly authorized by the Constitution of our state to make laws. This is what it says your powers and duties are as the local board of health. One of them is that you're supposed to enforce through the local health officer or the administrative officer appointed the public health statutes of the state and rules promulgated by the state board of health and the secretary of health. Your job is to follow the public health laws of our state and enforce them through the health officer. You're also supposed to supervise the maintenance of all health and sanitary measures like masking and quarantine and isolation. Those are sanitary measures. You're supposed to be supervising the maintenance of those and protecting our health with those. All of this is very clear that it is your duty to enforce the health laws of our state. And that seems to be the opposite of what the point of this medical freedom resolution is. From the initial version of it, there were several therefore clauses in there that would have undermined these powers and duties that are listed here in our laws of our state. You in the initial version of this wanted to strip the health officer of power after 24 hours when an emergency was declared. So I don't buy that this is just something that you're saying to make a statement. It is very clear that the intention of this is to undermine the public health laws of our state.
That's not in the
Please let me
resolution.
finish my statement.
That's
if I
not
may.
in the resolution, though.
It was in one of the original versions of this. And just by having this discussion, right, by making this a topic of the Board of Health as something that we have to listen to and go on and on about, you clearly are empowering people to feel that they have the right to ignore the laws and rules of our state. The governor of our state has the authority, had the authority during the pandemic to issue mask mandates and to do all of the measures that
Disputed, by the way. Highly disputed.
the governor, there have been several lawsuits about whether the governor had that authority or not, and none of them have been successfully argued against the governor. The governor clearly has the authority to issue all of the laws that he did. That's how our public health system works. As one of your Board of Health members stated, unfortunately, for people that are really into their freedoms, public health is restrictive. We have laws regarding tuberculosis infection control because it's a highly infectious disease. And medical officers need to be able to understand when people come down with that disease. The hospital systems are required to notify our public health department when someone is diagnosed with public health and is being treated in a public facility, because public health has the power to enforce quarantine and isolation. We need those rules to keep us safe as a community. It's the same thing with hand washing, right? We have a public health department that inspects restaurants, and part of what they're doing is making sure that people are following the laws there. They check food temperature. I assume they do some sort of monitoring and there's a reporting process. If people aren't following the law of washing their hands, if they work at a restaurant, and like what the resolution that is being proposed to be passed is stating, if I don't feel like, if it's my personal opinion that I don't want to wash my hands, I don't have to, because I don't have to put anything onto my body. I've thought about whether it's a good idea or not, and I've decided that I don't have to wash my hands. I think that's a terrible idea. I think this approach to public health of saying, oh, there are some things that individuals might have questions about, or some doctors have said one thing and some doctors have said another thing. That is not how local public health is supposed to work. We have a system of public health in our state that is directed by people with a lot more expertise and experience and capability to react in emergent situations. You're trying to, with this resolution, make a statement that people should be empowered to do whatever they feel is right for themselves. That is not how you respond in an emergency. There needs to be clear chain of command. There's an emergency response protocol, and we don't have all of the information when a novel virus shows up to do all of the research ourselves. You as Board of Health members don't have the time or the compensation or anything to be able to evaluate every single piece of evidence coming in an emergent situation and make the right decision for yourself. That's why there is a statewide public health system with many, many doctors and public health professionals that understand how to evaluate the trade-offs that we have to make. During the pandemic, we did not know how deadly COVID would be. We had to respond in the middle of the situation. Isolating people, implementing measures that reduce what we knew was the transmission agent through respiratory particles, those are reasonable precautions for public health to implement to slow the spread of a virus that we do not understand. We need to have a system that follows reasonable precautions and doesn't just send everyone out into the community to do their own research and hope we come up with the right situation when there's not enough information out there to even answer the questions. So I am very much against this resolution. I think that I'm against this. This is terrible.
Thank you for your comments. Couple more.
My name is Peggy Malone. I'm a registered nurse and I'm the board president for Community Health Partners. And I have a different approach to this resolution. Parents care for their children and protect them. Siblings care for each other. Adult sons and daughters care for elderly parents. Spouses care for each other. Teachers care for their students. And healthcare providers care for and protect their patients. Society cares for and protects its members in a variety of ways. We have speed limits and caution lights in school zones to protect school children. We have standards for safe drinking water to protect all of our residents. We have building standards and inspections to protect the public from harm. We have testing and licensing for drivers. We have standards for education. We have flame-resistant nightwear for children, all designed to protect the vulnerable. Many of us have a duty of care and protection because of our profession and our position. Licensed caregivers and elected officials have a duty of care and protection for their constituents. In exercising this duty of care, we must use our best judgment based on scientific research, documented facts, and the opinions of experts in a variety of fields to protect the vulnerable in our society. We object to this document as it fails to consider the protection of the vulnerable. It seems to be focused on the inconvenience and perhaps the discomfort of the mandated measures and unsubstantiated claims of harm, rather than on the purpose of the mandates, which was to protect those that are most vulnerable. Among the vulnerable during the recent pandemic were healthcare providers. They lived with the restrictions like the rest of us, all the time wearing head-to-toe protective clothing for 12 hours or more a day. They faced continuous fear of exposure. They stayed away from their families to avoid exposing them. Some of them moved to separate accommodation. As well as isolating, they took many extra cleaning and disinfecting tasks to protect bringing the virus home to their spouse, their children, or their vulnerable family members. They suffered emotional trauma as they cared for overwhelming numbers of people who were incredibly sick and dying. They worked harder than they have ever worked before. They became physically and mentally exhausted. Some left the healthcare force, leaving our society with a shortage of qualified caregivers in all ranks. Some looked for help from mental health providers. Were they harmed? Yes, but that harm was because they were caring for others who were vulnerable. Did we do everything right during the pandemic? We certainly did not. However, let's learn from our mistakes. We need to evaluate and adapt as new information becomes available. Let's step back and reconsider. What is our duty of care? Who are we supposed to protect? How can we use the knowledge and skills of experts to guide our decision-making? How can we best protect and support the vulnerable in our country? How can we protect and preserve those who care for us when we are most vulnerable? We need to do our duty of care. Therefore, we request that this resolution not be approved. Respectfully submitted, Community Health Partners, Board of Directors, and the undersigned. Thank you.
Thank you for your comments.
Hello. We all know we have plenty of policies and procedures and laws and all kinds of hierarchy, ruling what we're supposed to do and not do. And what if some of them are wrong? What if some of them aren't really honest? That's what we're questioning. What if we found out that the research, which there's so much of it on both sides, is what it is? There's right and wrong. What if some of these agencies are given too much power, which some of us believe they are? And that's the main concern that we have, the constituents that Kelly is speaking out for, and I am all for what you're doing. So thank you.
Thank you. So motion is on the floor to adopt this resolution. Think there's been a lot of discussion.
Is there a motion on the floor?
Yeah, motion was tabled from the last meeting, so it's on the
Thank
floor
you.
already.
I'd like to make a couple of comments, or maybe three. It's interesting that there's such a flap over the resolution, and yet one of the condemnations is that it doesn't do anything. So that seems kind of ironic. The other issue is one a little more, the licensing, we've grown up in a universe that seems like you need a license or permission to do anything and everything. Now, I've driven in Israel, I've driven in Venezuela, I've driven in India, and I've driven in Massachusetts, in Boston. And the laws are essentially the same, except I've driven in Ireland also. You can just transpose left and right driving. Everything else is the same because there's a commonality in there. If we do not drive according to common sense, we're going to die. And so the rules are almost identical, except trust me, you don't want to drive in India.
Boston's pretty tough too.
Yeah. So my point being is that properly informed people make their own choices, but the mandated licensing doesn't guarantee I'm going to get a decent haircut, or I'm not going to find someone that doesn't really know how to drive. I pay very close attention to everything around me as I drive. Some people are like, "Hi, Sam, you want to go for lunch?" You know, anyhow. Then the other thing is back a while, a number of years now, there's this friend of mine who's deceased now that I've mentioned from the Soviet Union. He was a member of the CP over there and very highly placed. And we became good friends. And he said to me two things fairly soon after we got acquainted, which was, Pravda would be envious of the propaganda machine in the United States. And this was 25 years ago. And the other thing he said, you guys, you Americans are in real trouble. Why? Because you do not know how to deal with bureaucracy. And I'll stop there.
Thank you. So let's put it up for a vote. Call for abstentions first. Anybody want to abstain? Okay, all in favor, say aye.
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 Aye. And I say aye. Opposed?
Opposed?
So the resolution passes 4-3. So now we can move on to new things. So second would be, we had an RFQ, which is a request for qualifications that was sent out. Only one respondent came through, and so the contract is over at the end of this year. What would the board like to do?
I would like to make a motion that we rewrite the contract to extend it another year or even two for Dr. Krager, the only applicants that submitted information to us.
Before I take that motion, there has been some, there's an idea that we can do without the second doctor. Dr. Melnick, for example, who is part of the contract, and he's the main contractor where Dr. Krager is the subcontractor. A lot of people that I have heard are not happy with Dr. Melnick. He's never been to one of these meetings, and I don't know why we really need to pay for him. So I asked Dr. Krager if he might be interested in coming direct with us. And he has expressed some interest. So I would like to entertain a motion. Well, let's just talk about first. Yeah, your motion is on the table to renew the existing contract with the old doctors.
So if I remember correctly, the contract is with Clark County.
Correct.
Okay. You're suggesting we specify a person?
No, that we let the contract elapse in December with Clark County, and we contract directly with Dr. Krager, or Dr. Krager directly. And yes.
So I guess my one thought is that what happens when he's sick or Goes on vacation.
That's easy. We got a regional health officer. The new regional health officer is exactly that. Is what they're supposed to do, is take over for vacations and sicknesses.
That's what they said.
And I guess my other comment is how does that impact the budget, or have we had that conversation about the budget yet?
I think at this point, we're just going to kind of recommend it and kick it over to the commissioners to do the contracting. And I don't know what the price negotiation would be, but probably wouldn't change. I hope it wouldn't increase.
So a proper motion would be that we move to recommend to the Board of Commissioners that we hire Dr. Krager for a health officer. Is that,
And let the,
well, you're making a recommendation to the other
right,
board.
and let the existing contract with Clark County expire.
Want to make sure I'd like to make sure that that's legally acceptable. Must be a reason why it's with Clark County, but I think letting the Board of County Commissioners know our desires with Dr. Krager, I think makes it pretty clear that the ultimate result should be to do that.
Does the health department have any input on how that affects legally if we separated from Clark County and hired privately? Is that a possibility?
Lewis County did it.
We have had that arrangement in the past before where we've contracted directly with a health officer. I know there would be a question of the cost. There's medical benefits and things like that that may not be factored in right now because Clark County, we're contract with Clark County, and there's I'm not sure exactly the breakdown, but that might be something that's factored into the cost as well. So I don't know what that piece would look like. The legal question of kind of shifting gears now, I'm not sure. We typically go out for bid and collect responses. So I'm not sure what that looks like, if we would need to do that process again and receive an application directly from Dr. Krager, or if we could just enter in. That would be a question maybe for legal to look at.
So the actual response didn't come from Dr. Krager, it came from Clark County.
Clark County Public Health,
Okay,
that's who we
so
contract with.
You have to make sure
Yep.
that's double.
And Dr. Krager is assigned to Cowlitz County, yeah. So, and I'll just add to that, I think, a couple folks have met with Dr. Melnick. If was ever a desire to have him be more present, we could certainly ask him to. I don't know that Dr. Krager has been assigned to work with Cowlitz County, so that's who our primary contact has been. I'm certain Dr. Melnick would be more than happy to come or be more present if there's a desire to have more involvement from him.
I'm curious, there seems to be benefit probably to working closely with Clark County in terms of how diseases spread and other things like that, and having that connection. And since Dr. Krager seems to make a lot of people happy and he's the primary contact, then I guess what would be the benefit of not going through Clark County? Or is there benefits you see as the health department for going through Clark County beyond just the individual person, but having that as a contract?
We do see a benefit to having a health officer that's closely connected to our neighboring counties. And part of that is that there's often crossover between diseases that individual counties are seeing or experiencing. And just having that knowledge, or being able to ask when we're having our regular time, hey, what are you seeing in Clark County, or what are you seeing in Pacific County? Just for that knowledge and awareness, that has been helpful.
See, I don't see it at all like you see it. You're perfectly free to call anybody in the other counties, including their health officer or your counterpart there. And this notion of 24 hours availability, that kind of stuff, that doesn't seem realistic. The health officer isn't your normal family practitioner. He's looking at the bigger pictures on a typically larger time scale. We're not going to call a pandemic based on a phone call, or we've got to understand things a little more before we jump into action. And to be honest, I thought our health officer wasn't as helpful as I had hoped for. Remember, I've been asking for balanced information, and we got zero balanced information out of our health officer. At one point, we even asked for, okay, we've been focusing on the propagation of the disease. How about focusing on the cures? And Dr. Krager was kind enough to provide us an hour of pharmacology that was of no use to us to decide anything. And I want to avoid that. I think that group has failed us, and I will not sign a contract. I'm speaking now probably ambidextrously as both the Board of County Commissioners and both on the Board of Health. I will not sign anything that resembles a continuation of that. Now, I do not know what forces Dr. Krager was operating under, because he wasn't the boss. If he would like to go independent and assures me that there is no subservience to the Clark County entity or Dr. Melnick himself, I probably would entertain that discussion. Am I afraid that we will be without a health officer? Well, even in the rules there, it says the regional health officer will fill in until we can find somebody. And all we have to do is make a good, conscious effort to find a health officer, and I intend to do that.
So just to make it clear, Mary Jane, do you want to withdraw your motion to continue the existing status quo contract?
You know, I guess I think that we don't have enough information. We don't have an idea of how it's going to impact the budget. Sorry. I'm not certain with Mr. Mortenson's comment, he's not going to sign a contract. Is that, I don't quite understand how that plays out if we decide to, go back with Clark County or hire Dr. Krager. I don't know how that works. I think that we need to understand more. And at a minimum, are we going to be without a health officer after the first of the year? Do we have time to do all the research and make all these shifts if that's the approach we take?
We can be a month or 2 months without our own health officer. That's what the regional health officer coverage is. There's a specific line in the RCW someplace that says you've got some time to.
If there's a vacancy in your health officer, I think the state can appoint a health officer for you.
Until we find out.
Until our local
Yeah.
body can appoint one.
Correct.
And it would probably be someone from the regional health office, I think is what they're called.
And in the meantime,
Happy to
if we,
abide by that.
and if we had some kind of a epidemic come up with zero health officer at all, I'm sure we could contact one of the other counties' health officers, and as well as the regional health officers from the state. I don't think we'd be vulnerable without one.
Yeah, in other words, we should not be
Well,
forced into something precipitous.
Yeah.
I'd like to be assured that we would have coverage if we didn't have a current health officer. So I don't know how we find that out, and is there any way to clarify that?
I think we just said it's the regional health officer.
Well, we can't locate him because he won't come visit us. I've been trying to get an appointment
This
to
is,
meet
this
him.
is just a stopgap. You were saying, what if we really needed one now? There's something going on. And
Okay,
our health
Well, quite-
officers on
quite
vacation, we
honestly,
got the
the-
same problem.
life assurance.
Quite honestly, I am not at all interested in having Olympia pick our health officer. That goes opposite to what the tone of this board is. I'd just soon have it within Cowlitz County's jurisdiction. So.
What?
The contract expires at the end of this year. this is gonna be the last Board of Health meeting for this year, unless we need to call another one, but I don't think it's necessary. I think, in the interest of time, since the commissioners meet more often, I'm inclined to make a recommendation to either end or not end the contract, or maybe just the recommendation would be for the Board of County Commissioners to finish the contract and make preparations for the next contract,
Just to-
whatever it may be.
Just to throw out another option too is we could do like a 6-month extension on the current contract to avoid the state appointing someone or something like that. So that's another option as well too.
Is month to month? Is that a possibility?
That'd be kind of hard.
We could talk about, I mean, it seems more complicated.
I feel like if there would have to be a discussion every month, that would be really.
Oh, no,
so-
I'm talking.
I mean, 6 months would give enough time for us to really consider this if there's a lot of different perspectives, and it seems like there might be. So
Yeah.
I mean, I think that sounds like a very good compromise for the time being if there is not consensus on what we want to do here.
Is that a motion?
I don't think
There's
so.
still
I don't-
There is still one on the table. So my question is, and the concern about contracting with Clark County is that we don't see Dr. Melnick, and so we think we're overpaying, or?
No, the contract's just over.
So I guess I'm not understanding why make a change if we're content and staff is content. I'm not sure that you're content, but if everybody else is content with the status quo, is there a good reason to change?
I don't know if everybody is actually content with the status quo. It's just that we only have one person applied for the job. I kind of feel that maybe we didn't do a good enough or thorough enough job of advertising for it, promoting it. I don't know what happened there.
I want to echo what Mary Jane says, as being a new Board of Health member, I haven't heard a lot of reasons not to, except what was just articulated here and the concern about Dr. Melnick not being present, but it sounds like Dr. Krieger, people appreciate his work and he's been present. So, I mean, I'd like to know, yeah, I guess the concerns around that. And if that's a longer discussion than that, at least temporary extension could help with that. But I'd be interested in that conversation.
So what does the board think? Rick, what do you think? I'm just calling out.
Well,
names
I'd
now.
be interested in taking a closer look at having Dr. Krieger be the health officer for Cowlitz County. I think we need to take a little closer look at that. He's here. I think we've interacted with him quite a bit, and I think there's a comfort level there.
So to kind of facilitate a decision, shall we do a 6-month extension of the existing contract and explore a more permanent appointment with Dr. Krieger? Would that fit the bill, since we're kind of under a time crunch?
I don't know that we have to extend the contract if we like Dr. Krieger.
Well, we won't have a chance to meet.
No,
Again,
you will.
we,
That's why I'm kicking it.
of all of us here, I have spent the most time with the Melnick Hager combination, other than HHS individually with issues, and I don't have visibility into there. I will not sign any extension or any continuation of what we went through in the past. Certainly, providers are happy, but providers aren't the public. If you look and just follow the public sentiment, how we dealt with COVID, and I alluded to, or I hadn't mentioned specifically, the biased information, that's something that I cannot tolerate and accept. You've got to have even-handed information. And we didn't have that, and I pled for that many times, and in discussions, it we went through the are effective, if you get to hear this and that, and they just get on and on. Every prediction, every assertion, every demand failed. So why in heaven's name would you hire a contractor who did not paint your house properly? Why would you hire him to paint again? It just doesn't make any sense.
And the state is set up with the regionals that I think we have the coverage to give us time. It's not going to take 6 months or probably even 2 months to vet a deal with Dr. Krager and decide if that's how we want to go. So we'll be covered.
I agree with that.
So then a recommendation from the Board of Health to the Board of County Commissioners to explore appointing Dr. Krager.
Directly.
Acceptable.
Yes.
I'll make that motion.
There's already a motion on the table.
Yeah, there is a motion.
I'm
on
just
the table.
saying.
Do you still want to keep that?
So Mr. Weber, what is your motion?
To recommend to the County Board of Commissioners to make an arrangement to hire Dr. Krager directly.
I'll withdraw my motion and second your motion, even though we don't really
Yeah.
need a second. But we have somebody's,
Okay, so the motion on the table, you want to restate it one more time, just so we're all
I
clear.
move that the Board of Health make a recommendation to the Board of County Commissioners to make a permanent arrangement with Dr. Krager as our health officer.
Look into it.
I would offer an amendment to that. Just tell the Board of County Commissioners to explore an arrangement with Dr. Krager and anybody else that we might find in the future on that, or in some amount of time, like 3 months or something like that.
Yep. I like that. Do we hear from the public?
This is like your guys' number one job is to appoint the health officer. That's like the main thing that you're here to do. So I'm incredibly perplexed why we're at this point where you can't even like carry out the process that you initiated, right? I came here when the RFQ was first being requested for the health department. And Mr. Mortensen stated at that time that there were no concerns being raised about the current health officer, which apparently either something has changed drastically since that time, or it was just an obfuscation and a ploy to be able to move the goalpost at this time to say that there were no concerns, we're just doing the RFQ process as a formality. At the last meeting, the health department had reviewed all of the RFQs that they received and was prepared to move forward with the apparently successful bidder, right? When government procures services, you have to have a fair and transparent process. You had your health department issue a request for proposals for people that wanted to be the Cowlitz County health officer. And now you are discussing doing something entirely different than that. So I think it would be very pertinent for the county to actually do some sort of review with your purchasing department before going forward with this motion. It is possible that you are violating procurement rules and regulations. I don't know, but someone should look into that. If you have issued a request for proposal and you have a qualified respondent to that, there has to be a clear reason why you are rejecting that proposal if you're going to go then procure the same service in a different manner. If there was dissatisfaction with the current health officer, if there were some legitimate concerns why that person shouldn't be our health officer in the future, those should have been stated at the start of this process. I also find it concerning that you don't seem to follow Robert's Rules of Order. When someone makes a motion, you did away with the need for a second. That's a legitimate motion on the table. you should take a vote on that motion, not make all of this position statement and then strong arm someone into retracting their motion. You should just vote on the motion. If everyone's going to vote no, and move on to the next thing that you want to do. I think that this process is not transparent. It appears to me that Commissioner Mortensen wants to use the pandemic as a reason not to contract with our current health officers, and has not been clear and transparent about that until now. So I think that this board should discuss what are the concerns and the reason that whatever those concerns would prevent that person from being the health officer in the future. From what I can tell, our health officer has been very responsive to try and answer all of the Board of Health questions. Mr. Mortensen mentioned extended deliberation where the health officer came to discuss to the best of their ability what they were seeing. This does not feel like a fair and transparent process. You have a proposal through the RFQ process that you as the Board of Health issued that is a responsive bid. So for you to now at the last hour come in and go back to the drawing board, I find that dishonest. Thanks.
Hello. Very vigorous discussion. Arn, I agree with you. And I want to know where this guy stands, if he's an independent thinker, because a lot of what happened with Board of Health people, I mean, not Board of Health, but health officers was rubber stamping what the CDC was doing, and the CDC has been proven wrong during this pandemic. Others, the CDC is basically just a vaccine promotion agency, and essentially the one thing that really, for me, solidified how ridiculous they are to rely on for actual information was when they said, if you protest for Black Lives Matter, you're not going to catch COVID, but if you protest against the mandate, you are going to get COVID. And they did that.
Yeah.
And that was the most ridiculous, most politicized things I've ever seen. And that's when early in 2020, I really knew we were facing a ridiculous situation where there was going to be massive amounts of misinformation, massive amounts of propaganda. And there have been so many lies, so many distortions, so much obfuscated truth. If you really want to know how public health is done, you should actually look up Dr. Bhattacharya, a triple doctorate from Stanford, who wrote with 15,000 other epidemiologists an objection to how this was being handled. And he was censored by the federal government through Twitter, had his Facebook page destroyed, his YouTube channel destroyed. And this man is one of the most credible men in the world. And that's if you want to actually see real data about epidemiology and how it works, he is the man to go to, and not our podunk doctors that we hire that rubber stamp from the CDC. So I agree, a vigorous process should be done. And maybe when Kreger was being looked at first, maybe the information about COVID had not happened yet. So I would say, be cautious and get an independent thinker.
Thank you.
I'm not gonna go back into any diseases or anything, pandemics, so you're good. Now, there's a time constraint as to when we're supposed to have a doctor ahead of the,
Well, the contract expires at the end of this year. There are a few provisions that if we don't have a health officer, that we would be okay for a while. It wasn't fairly
Okay.
clear from the lawyers. And I would say that if an emergency came up, there's no reason that we could stop us from calling any other county health officer.
that could possibly cost more. And what I was always against, and I think some other people, your constituents that have been here but aren't today. And this is, I'm going to apologize as being a public that the last gentleman was accusatory, because this has been brought up before. I was at the previous meeting and I heard it's all, it's nothing new. You're being very transparent. So
Thank you.
It's nice to have it. It originally was in-house. It's probably at one time in history split up with Clark County because it was economically feasible. But I kind of in an agreement that it's nice to have things in-house where we have one person that we can contact. And is this doctor still going to be part of this Clark County group? The name that's on
I
the-
would think so because we only contract for basically 1/5, one day of of the week is.
Oh, wow.
Kind of works out.
Kind of
It's so-
scary that you don't
so-
have that much information. One guy spread. And when they're down in Clark County is a lot bigger area and it's nearer metropolitan. It's kind of, to me, kind of shaky that we don't have it in-house, but if we can't do it, can't do it.
It's
So-
not bigger in area, but it's about 4 times the population. That part is true.
Yeah, and
It's smaller geographic area.
and to get somebody to come up here once a month would be kind of nice to talk to you, you know, really? Is that too much to ask? Can we kind of have that part of his job scope is answer questions?
Well, in
Yeah,
his defense, he did send the deputy.
That's kind of, okay, you get deputies and things, okay. All right. Wow, you're really clarifying a lot, so thank you. I'm gonna let you go. You got a motion on the table and one name. I was concerned about kicking it down 3 months because that would take it past December and we don't want Olympia meddling in this.
Yeah.
So we need to tighten it up. If not, go ahead and move forward. Like, I think you guys were on the same page here. Let's continue on.
I'd like to add one thing, Mr. Chairman, the Lewis County Board of County Commissioners terminated their contract with the same group with which we currently have a contract, and I wish I knew exactly what, I think it was terminated within the termination clause as opposed to expiration clause. And they had the very similar concerns I've got. And they got themselves a health officer that's I think he's a pediatrician there, although I'm not. Yeah, and he doesn't have an MPH, but you don't need an MPH. They desire an MPH if you're in the job after 3 years. They say, okay, we grant you that you are no longer the interim health officer, you are the health officer.
So I think that Mr. O'Neill brought up some interesting points about the transparency and, you know, if you put a request for qualifications out and you get a response that is
The same,
say it again.
the same.
Well, but that meets the requirements. Do we have a responsibility to hire that person? And I think that that's an interesting conversation. And I don't know the answer to that, but I think it's a.
No, you're.
I don't know if our
I don't
attorneys
think
are
we have a
for-
responsibility to keep doing the same thing over and over again. I don't think that that's the
If
responsibility.
we're doing something problematic, our attorneys always take a look at our meetings and they'll grab a hold of us that this speculation could be endless.
So the motion on the table is for the Board of Health to recommend to the Board of Commissioners that they look into a direct contract with Dr. Krager and any other.
No,
qualified-
there
qualified people.
was a motion to amend that.
Oh, what was the motion to amend it?
Yeah.
Commissioner Weber?
To amend that motion, so we vote on the amendment,
sorry.
which is simply,
So the voting of the amendment is to look into any qualified candidate. Is that correct?
yes. And you can have a specific mention, try and work a contract out with Dr. Krager and or any other,
Qualified candidate.
something like that, yeah.
So my question is then, would this board see any other qualified candidate, or would that just be a decision made by, we would be blindly voting for whoever? Would it come back to us if you rustled up 4 more people, or is that gonna come back to this board?
I would,
I think that's a reasonable thing. to
yeah,
do.
I would think so.
And I'm not sure that I've heard Mr. Weber agree to the amendment.
But he doesn't have to agree to the amendment. We do vote on it.
So the motion, the amended motion on the floor is to have the Board of Health recommend to the Board of County Commissioners that they investigate and contract locally with Dr. Krager or a qualified candidate.
I don't know what the locally means in there, but
Well, sorry, I mean, direct contract.
yeah.
So is that about right, Commissioner Weber?
That would be the effect of his amendment. Yeah.
So let's take a vote on the amendment and then we'll go back to the original motion. So the amendment is to look at Dr. Krager or other qualified professions. So take all in favor of that amendment, say aye.
Aye.
Aye. Opposed?
Oh,
Is that opposed? No, and so 4-3, it passes, the amendment passes. That we will look into others if there are other qualified people. And now the motion is, wish you could read it. Motion on the floor is for the Board of Health to recommend to the Board of County Commissioners to contract directly with Dr. Krager, to explore contracting directly with Dr. Krager or other qualified candidates. And I'd say in a timely manner. So that's the motion on the floor. That everybody got that one clear? Did I say it right? So we're all transparent and clear. Okay, so now let's vote for that. All in favor of kicking it over to the BOCC? Say aye.
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 Aye. Opposed? No. Commissioner Weber?
I voted yes.
Yes. So 5-2 passed. Okay, so now you guys are gonna have more stuff to do. Sorry about that. Okay, I'm tempted to do the very same thing with the budget for the budget. Commissioner Weber, you wanted to talk about that, so would you like to say a few things?
Yes, and thank you, Mr. Chairman. I appreciate you following up on a suggestion that I had made.
Did you see there was several emails that came from?
Right,
Good.
right. It had occurred to me that during our budget workshops, the 3 county commissioners included the health department's recommendations for budget. Although we haven't formally adopted the entire budget, usually once we reach consensus in a workshop, that becomes part of the budget, and we finish doing that. And that budget is somewhere around $3.5 to $4 million for a whole variety of different programs. Virtually all of that money is grant money that comes to us because the state has determined that we qualify for certain types of programs. Sometimes we choose not to accept the grants. And sometimes, although most of the time, almost $4 million worth of times, we have accepted the state's recommendations. At some point, it seems to me that this board needs to be in on providing the advice, because in addition to the health officer, our responsibility is to prioritize the public health issues facing Cowlitz County. And so we're not talking about an insufficient amount of money. We're talking about a lot of money. And I would like I'd like to propose that while it may be too late to make an informed decision for the board this year, we'd be thinking about having a process where we consider the options that our department has identified, or maybe revisit the idea that the state has offered funding for an epidemiologist who can develop the data that we need to really verify what are the priorities. Right now, we're letting the state kind of set the priorities. and there's a bunch of it set in state law, like, keeping track of death certificates and birth certificates. That's just an administrative function we have to do. So I wanted to bring that to our attention, get it on the board, that we really need to have a more of an intentional approach on prioritizing the public health issues for Calhoun County and making the recommendations budget wise. So
I appreciate that. So what I'd like to do is include that as sometime in the next year, we look into that seriously, into the budget, into the details.
So one of the ways that we can do that is if we regularly schedule 2 reports, whenever this board meets, one report from the health officer on the state of health, what's happening. Doesn't have to be necessarily very long, but just an update on what he's been able to do. And then from the department, those suggestions and ideas, they're dealing more directly with the public and is going to be much more aware of the challenges ahead of us and the other recommendations. So it's just something we need to just, starting in January, let's start hearing those reports, and that should generate some recommendations from us, I would think.
Yep.
Mr. Weber, are there funds that right now available for our county to hire an epidemiologist?
I'm
you know?
assuming so. I mean, that's been a standing offer from the state that we could have. And I'm not sure if that's a full-time person or somebody that we hire, population oftentimes determines how much funds they make available to us. But I can't remember, Carol, I know you're back there. When we talked about it before, was it a full-time or was it a part-time epidemiologist?
It was just a contract set for a not to exceed and
Yeah.
basically a $40,000 or something like that. It was a contractor as opposed to employee.
Can't remember. Yeah.
Yeah, we currently contract just part-time. We have, I think, a small contract of $10,000 or $15,000 a year. And it's just more of an ad hoc when we need something, we reach out. The state, we do have funds available from the state to hire whatever capacity of an epidemiologist or assessment person that we would like.
Wouldn't necessarily be a permanent position, but.
No, it could be
Just-
contracted. It doesn't have to be an employee. It could be whatever the county would choose.
It's just an idea, because I think it's important that we make our decisions based on data that's collected. And if we have our own employee, we can kind of guide.
I agree with your points. One point of caution is I really enjoyed the epidemiologist we had. A bright lady, did lots of good stuff, but I could never take it from what I would call which interested me, academic kind of paper, to a decision that we would recommend or work with HHS to do something. And I'm not sure I'm against that, but if we do epidemiology, that word studies, I would like that to be sure that say the epidemiologist can get a paper or a publication out of that so that it can be shared. There's knowledge, if we're paying for knowledge that we locally cannot use because we don't have control over stuff, but it should be known. It's the same argument I had with the autopsies of the coroner. It's like, let people know what it is we're seeing.
Seems like that could go hand in hand with something like a community health assessment. We're talking about identifying priorities. How do we do that? So how do we know where to put the budget money, which seems really smart. I appreciate you bringing that up. And I know that a lot of communities do community health assessment, get the input like we're hearing here, but on a much broader scale on what are the health issues we're facing. And if there's funds for that, I'd be interested in hearing about them for sure. And then to go to your point, to take that leap from this is what we're seeing in our county to this is what we can do about what we're seeing in our county. And this is how we can share that information. I'd be all for that too. So I would appreciate that conversation.
So lots to discuss in the coming year.
Yeah, one thing, the epidemiology is that big. And typically we get the basic information through all the services, and that's I'm sort of objecting in part to spending effort on this part. It's academic. And I'm okay with academics, but anyhow, enough said. So you're right, we need the data.
So I don't think there's any action needed on the budget that's been proposed, and it's something that the commissioners deal with anyways, is monetary budgets. So does anybody have any further discussion on that?
Yeah, I'd like to add, I like what my colleague has suggested. I think if we're really serious, we will probably have to meet certainly more frequently than a quarter. And the reports don't need to be extensive. We don't have to meet for 3 hours when we do meet. But the budget is a concern that we try to squeeze in at the last hour, and I don't particularly like that.
Well, so just to follow up, we are scheduled to meet next in January, okay. And I'm wondering if perhaps at that time, Carol can have a proposal for us for an epidemiology funding.
And I would ask too, to talk about the budgets, that monster spreadsheet you sent, and you told us it was going to be difficult. If there was a way we can kind of distill that a little bit more for next year to talk
It's
about it.
just that HHS has all kinds of obligations that can be categorized, and just pick a category each month.
Yeah, absolutely.
Thank you.
I would also maybe like to hear about some of these state funds that we may or may not be accepting. If there's some state funds that we aren't accepting, to hear more about what kind of services those may bring the county. So if there's funds that we could tap into, I'd be curious, related to health, I'd be curious to hear more about those because I might not be familiar with them.
Lots of money out there for sure. Please.
Thank you. About the epidemiologist, if you hire someone, make sure they have an open mind, no preconceived notions, and no desire to prove something or disprove something, but to actually look at data. One of the problems that we're finding with the actuarial group is the 30,000 group of actuarials have looked at the data with COVID and saw that hospital treatment was actually one of the precursors of death. Putting people on a respirator before that was needed, because one of the things they were recommending was wait till you're sick, go to the hospital, put you on a respirator, give you remdesivir, and then people would die very rapidly with that happening because remdesivir is a toxin. And so they've noted that a lot of these mysterious deaths weren't from COVID, but from the treatment of COVID, and some of them were from the vaccine, and that has been demonstrated repeatedly. And this is coming from the insurance actuarials who look at risk and who have to decide, how do we insure people? And there are some situations where they're considering not insuring people who are vaccinated because of that. So when you're looking at death and disease, make sure the person is looking for the right things. Thank you.
Thank you. So with that, anybody have any further comments?
So our next meeting is January 30th.
January 30th.
Thank you.
So I'd like to wish everybody a happy Thanksgiving and a Merry Christmas. And adjourn this meeting at, what's the time, the correct time?
12:24.
12:24. Thank you.
Did you miss any appointments?
Okay. Coming out of recess from the BOCC.